Okay, thank you.
This is a printout of bills, sorry.
Okay.
But I am in favor of these resolutions and bills. Want to speak specifically about 289, the resolution to Congress. A lot of the things we do in this building are trying to see what we can do to take advantage of the federal support that's available, to take advantage of Medicare or Medicaid money or other federal benefits and grants. And a lot of energy is spent in doing that. And if the federal government would pass a single-payer bill or something of the kind, it would fix so many things in the state's finances. It would fix so many things in the cities and towns' finances. You would see a decrease in the OPEB liabilities that cities and towns and quasi-publics are facing. You'd see the state budget itself improve considerably. This is just a really easy measure that we could use that would really improve our state's finances. Unfortunately, not all of our senators are behind it, but I think it's very much the role of the Rhode Island Senate to be asking our federal delegation to do something to improve our financial situation, because this has been tried in many other countries. We know it's going to improve things at a financial level. It's one of the most consequential things we could do in improving the long-term financial health of our cities and towns and our state as well. So just on that point alone, I think the resolution is well worth supporting. I know the theory is supposed to be that insurance companies use their buying power to allow people to pay less in healthcare costs because they are relatively large entities. The theory is they can negotiate lower costs for everybody. So if you're just one individual or a small pool of individuals, you can take advantage of the rates negotiated due to the large pool of individuals that go through this insurance company. That's not how it works out in practice. In practice, smaller pools of individuals are still charged more by the insurance companies than larger pools of individuals. The insurance companies are not living up to what they say they will, and it's a very inefficient system, and it really forces heads of families and individuals to go through a lot of the process of being insurance companies themselves. We're asked to pay co-insurance and co-pays and premiums, and when the insurance companies make lots of mistakes in denying or approving care, as they often do, we have to step in and we have to try to lobby our insurance company to make the right decision through our providers, and sometimes getting involved ourselves. It just is a really badly functioning bureaucracy that people just have to waste. Everybody has to waste time complying with. Physicians have to waste a lot of time dealing with the excess paperwork. Hospitals do, and many others. It would be, in addition to the monetary savings, it would just be a lot of savings in time and aggravation if we didn't have to deal with these bad decisions. So I am in favor of single payer. My personal preference, I'll just spend a little time saying it, is I actually do have some sympathy with the people who say that we shouldn't have the government doing this. I would prefer to have a single-payer program that's run by a nonprofit with elected leaders making these decisions. I think that would address a lot of the concerns people have who don't trust the government, and it would still render the same savings that you would get from other single-payer programs. And I think it's more politically palatable and would deliver the same advantages. So that's my preferences, but I don't feel strongly about that. I do think it's good to put together a study commission to look into this issue, to see how we may be able to establish something effective, and it should be something that the study commission that listens to the voices of people around the state and take steps to make sure people feel involved, the people feel that they have buy-in, because if this is just another program that looks like it's being imposed from the top down without the general public feeling they're consulted, then it's not going to succeed. One advantage of a study commission is it really can take the opportunity to outreach to the public at large and make them feel like they're consulted in designing this process, which they do not feel under the insurance company run system. So I hope that this commission gets set up. Thank you.